the best of the week on Relevant Radio.
The general trend in professional bioethics and academic bioethics today is basically to serve as a rubber stamp to kind of wring your hands for a little while and scratch your head for a little while, but at the end of the day, to green light more or less whatever the scientific and medical establishment wants to do. And much of that is driven by money, by financial considerations.
It's the Drew Mariani Show on Relevant Radio.
Yeah, that was the voice of Dr. Aaron Kheriaty. He's going to be joining us. He came out with a new book. The book was called Making the Cut, How to Heal Modern Medicine. And I don't know about you. Have you ever felt like, medicine today's lost its soul? Like you're treated like a number more than a person, a case instead of a child of God. Well, Dr. Kheriaty in his new book, and it really is a good read. My producer, Tom, and I were talking about this morning, says that he believes that medicine itself has gotten sick, and he's calling for a healing that goes deeper than pills and policy. So we're going to talk about what's broken, what it's going to take to fix it. And I'm not opposed to digital technology. I think it's great. But, now you go anywhere to your doctor, your dentist office, you're doing everything digitally, right? You're filling out your charts, you're signing things on digital forms, you sit under fluorescent lights, a doctor enters a room, half their attention's on the screen, they're clicking boxes, maybe there's not the eye contact. And that's not how it's supposed to be. In this book, Making the Cut, Dr. Kheriaty makes a case that medicine's fallen ill. He says that we've traded the art of healing for the business of managing. So what's the solution? That's what I want to talk about today. Dr. Kheriaty joins me today. Doctor, thank you for making time for us. I am grateful for it, and I am grateful for your book.
Always great to be with you, Drew, and thank you for the kind remarks about the book and for that intro, which really, you did a great job distilling kind of the central themes that I try to tackle in Making the Cut. And the subtitle is How to Heal Modern Medicine, and that suggests that medicine itself has fallen ill or gotten sick. There's something wrong, not only with sick patients who have illnesses, but with the healthcare system itself. Something has gone wrong. And so, the book is part medical memoir of my training. It's got some harrowing stories from my time in medical school, which, hopefully are engaging to the reader, the kind of medical drama that you see on TV. But in addition to just telling what I think are pretty astonishing stories about the practice of medicine, the book also tries to articulate a more sound philosophy of medicine. What is medicine? What's the nature of medicine? And then from that, show how have we, in some respects, lost our way, right? So there's also built into the book a pretty stringent critique of our contemporary healthcare system, with some suggestions in the closing chapters of, okay, if that's the diagnosis of what's gone wrong with the healthcare system, what are some potential ways forward? What might the treatment plan look like? So that's Making the Cut in a nutshell. And look forward to digging into it and talking to you about it.
How do we get here is probably the best place to start, right? I mean, it used to be such a wonderful vocation. When I was a kid, I remembered I was a little kid. My doctor that, my mother had, I had a fever or something. I remember the doctor coming to the house to check on me, right? That was a very different world. Today that would never happen. You can barely get into an urgent care, So
that's right.
What happened to modern medicine? I mean, what happened to, was there a transition? Was it, one of my friends is a physician. He tells me how when he got into medicine, the doctor pretty much had control. Now it's a bunch of bureaucrats. There are more, for every doctor there's probably, several hundred people who make decisions, on policy and how many people you have to see. And there's so much bureaucratic, paperwork that runs the process. So where did we go off track here? What happened?
Yeah. Well, you're putting your finger on it in the sense that if you take all the people in medicine that have face-to-face contact with patients at some point, doctors, nurses, the front office staff, the X-ray technician who helps you get your X-ray. Take all those people and you add them up. Then you take all the people in healthcare who never encounter a patient face to face, and you add them up, it turns out that the latter category, the behind the scenes bureaucrats who never see patients, outnumber all the people who see patients. So we have this top heavy system that I call in the book, it's a system of managerialism. And managerialism has taken over medicine, as it's taken over other institutions in society, really in the decades since the Second World War. And this is the idea or the ideology that through the accumulation of supposedly rational knowledge, everything can and should be engineered and managed from the top down. And if you look around the world, there's different healthcare systems. So we have a system of mostly private insurance, some public insurance that pays for healthcare in this country. Very different from England, for example, which has a national health service, which is a single payer system where everyone is in the same system and the government pays for all the healthcare for everyone. In some respects, very different systems, but both their system and ours are infected by this ideology of managerialism. Mm-hmm. And I say in the book, it matters little whether the top-down control and management is coming from a government bureaucrat, as might happen more in the UK or in a country that has a nationalized healthcare system, or it's coming from some huge corporate conglomerate that just swallowed up all the hospitals and all the clinics in your region, right? Whether it's to corporate managerialism or government managerialism, it's still the same problem. And the problem ignores the fact that every patient is unique and that no sick person wants to be sort of processed through an industrial scale medical system that I call it turnstile medicine. If you go to Disneyland, Disneyland is engineered for people moving. They want to get as many people through as many lines and as many rides and get you fed and toileted and through as many turnstiles as possible in the course of a day, right? And to do that as efficiently as possible. Well, hospitals now operate according to that same principle of people moving, industrial scale people moving. So, for example, in this country, the Affordable Care Act has bundled payments for certain procedures. What does this mean? This means if you're getting your hip replacement, the hospital is going to get paid for your care what they would pay for every other hip replacement. But suppose, Drew, that you have some post-operative complication that most other patients don't have. And so you require a longer hospitalization, and you require more care and more treatment before you can be discharged home. Well, in our current system of payments, the hospital begins to resent you because you're not behaving according to this principle of efficient people moving. You're an outlier, and you're costing them money, and you're not being processed on the factory floor as fast as all the other widgets, right? All the other patients. And so we've developed this system of top-down control where physicians have very little latitude, very little discretion and decision-making ability to tailor their care to the needs of the individual patient. The care is all dictated by so-called guidelines. I point out in the book that back in the 1990s, there were 75 of these guidelines for physicians. By 2014, there were 7,500, right? So these things have metastasized beyond all due proportion. And they're called guidelines, but actually many of them are tied to reimbursement and payment. So if you don't follow the guideline from the government agency or from the professional medical society, which is very often bought and sold by the pharmaceutical companies, then you're not going to get reimbursed for the care that you're giving. So they're not really guidelines. They're dictating care. And doctors then have very little ability, or if they try to, they're actually going to lose money and not get reimbursed adequately. If they try to use their own discretion, use their own clinical judgment to tailor the care to the needs of this particular individual patient in front of me, who may not be behaving like every other patient who needs a hip replacement, for example. So we have to get away from this tendency of medicine to want to centralize everything and homogenize everything, make every patient exactly the same, because that's not how human beings operate, first of all. Every body, every human body, every medical history is unique. And the old-fashioned physician who had the freedom to use his own wits and his own experience and his own, hopefully, intimate knowledge of this patient and this patient's history, because I've been treating this patient for a long period of time, and I've gotten to know him, I've gotten to know his family, and I know his environment and his community and so forth. And so I'm in a position to actually help him in a way that some far-off, distant bureaucrat who's never seen this person face-to-face is not in a position to understand what's best for this patient. So we need to get away from this managerialist system that attempts to let a small group of technocrats who think they know best what everyone needs and therefore are in a position to control all of medicine. We need to get away from that, whether it's happening in a corporate context or in a government-run healthcare context. The end result is the same in both cases.
Yeah, I don't know how you do that, though. I mean, you've got this technocratic mindset right now that has taken over the medical profession. Doctors have been somewhat neutered as a result of this. And we also have seen the centralization of healthcare power. You know, you see it now in corporate hands, government as well. Has two things. One, I mean, has patient care been harmed by this? And secondly, if it is a serious situation, how do we change that?
Patient care has been harmed. Medicine is still good at certain things. Medicine is very good at dealing with sudden onset acute illnesses. So, Drew, if God forbid you get hit by a truck on your way home today, go to the emergency room and have the trauma surgeon patch you back together. Medicine is very good at that sort of thing. But if you have a chronic health condition, if you're struggling with obesity or prediabetes or Alzheimer's disease or autism or chronic kidney disease, medicine can sometimes help manage those symptoms. It can do some things for you, but we're much less effective at getting good outcomes for patients when dealing with chronic disease rather than acute disease. And there's a lot of reasons for that. One of the reasons for that is that this model of the body as a machine and the physician as a mechanic is not true to human life, right? So if you're hit by a truck, the trauma surgeon is kind of like opening up the hood and fixing the broken parts inside the machinery. That analogy is okay there. Right. But that's not what happens when you're dealing with a chronic illness. When you're dealing with a chronic illness, you have to understand that the body is the primary agent of healing. Let me give you just two examples of what I mean by that. A surgeon doesn't really close a surgical wound. Right. A surgeon takes the two tissues and sutures them together such that the body itself can heal the wound, if you stop and think about it, right? Even antibiotics, we think of antibiotics as zapping the infection, right? So you have a bacterial infection, you have pneumonia or something like that. We give you antibiotics, that zaps the bugs in your lungs, and then you're cured. That's not actually what happens. What happens is the antibiotics reduce the load of the infection sufficiently that your own immune system can then eradicate the infection. That's why people who are too immunocompromised because of AIDS or other medical issues, antibiotics don't work for them because they only work with the body. They don't replace the natural, healthy human functioning of the body. So medicine is a helpmate to what the body should learn how to do itself. And so one of the themes in my book is, people need to reappropriate and take responsibility for their own health and engage in processes that can help them heal and not just totally passively rely on the healthcare system to reach in and fix problems that in many cases were created by, lifestyle factors or dietary factors or other factors that the patient should have had some responsibility for.
Hey, you can join me and listen on the Relevant Radio app to The Drew Mariani Show live each weekday at 2 to 5 Central. Thanks for listening.